What is PPE? PPE stands for Personal Protective Equipment. PPE refers to any device or appliance designed to be worn or held by an individual for protection against one or more health and safety hazards. Where there are risks to the safety, health and welfare of employees, there is a duty on the employer to avoid or limit such risks whenever possible by methods of prevention or control. PPE is only provided where the risks cannot be avoided or limited by other means. There is a duty on employees having regard to their training and instructions to make the correct use of PPE. Employees should therefore use PPE properly whenever it is required to be used, report any defects in or damage to the PPE immediately, participate in any training or instruction provided on PPE, inform their employer of any medical conditions that they have that might be affected by the use of the PPE provided. PPE should be worn when undertaking common tasks associated with a suspected or confirmed case of COVID-19. There are 4 types of PPE which you may well come across. They are gloves, plastic aprons or gowns, masks and goggles. Gloves reduce the risk of exposure of staff to service users' body fluid and protect the service user from organisms that may be on the healthcare worker's hands. Always wash your hands before putting on gloves and after you have removed them. Perform a risk assessment. If you don't need gloves, don't wear them. Aprons and gowns are important as they prevent blood and body fluid splashes. Surgical masks are suitable for most situations. Do ensure that you change your mask if it becomes damp, wet or torn. Discard the mask when leaving the service user's room and wash your hands immediately after removal of the mask. Goggles provide eye protection and can be worn by people who normally wear glasses. PPE will be delivered to your house or unit in a bag or in a pack with everything you will need. It should be stored ideally outside the room in which the service user is being cared for. The importance of good, effective hand hygiene cannot be reiterated enough. Hand hygiene is the single most effective way of stopping the spread of infection. The regular, appropriate use of alcohol hand gel is key to reducing the risk of transmission when using PPE. Putting on your PPE is often referred to as donning. There are 6 key steps in the process. 1. Wash your hands. 2. Put on a disposable apron or gown. 3. Put on an appropriate mask. 4. Put on goggles if required. 5. Put on gloves. And 6. Check that your PPE is fitted correctly. In the next few sequences, there are video clips to show you this process step by step. Before donning your PPE, make sure that you thoroughly decontaminate your hands with alcohol gel. This short video demonstrates how to put on the disposable gown or apron. The gowns are one size, so you may need to adapt it for your needs. Here Dawn has created ties for the back of the gown by simply cutting the all-in-one section at the back. By doing this, Dawn has ensured that the upper part of her neck is well covered. You will also notice that more of her back is then covered when using this alternative approach. Apply the most appropriate mask as per policy. It is important to note when tying the mask that the lower tie actually is the higher of the two when tied at the back. This makes doffing easier. Dawn is demonstrating here how to put on an FFP2 mask. Whilst these are not frequently used, it may be indicated on occasions for use. If you need to wear an FFP2 mask, you should always check that the fit is correct. There are 6 steps in this process. 1. Place the mask over your nose, mouth and chin. 2. Fit the flexible nose piece over the bridge of your nose. 3. Secure the mask on your head with the elastic straps. 4. Adjust to fit and for comfort. 5. Inhale, and when you inhale, the mask should collapse. And then 6. Exhale. Check for leakage around the face. This is an alternate mask which may be available to you. To fit, simply apply each loop over each ear and ensure a good fit. Next, put on the goggles or other protective eyewear. Ensure a tight, comfortable fit and adjust with straps either side of the goggles. If you wear glasses, you can wear these under the goggles. The next step is to decontaminate your hands using alcohol gel. Then apply your gloves. The role of the body or the mirror is vital. These are just 2 ways for you to check that your PPE is correctly worn.
Now I'm just checking your front PPE gear. Goggles, mask, gown, gloves. Okay, and can you turn around and I check the back of your PPE gear. Goggles, mask, gown, tie.
There are 6 key steps to removing your PPE. This is called doffing. and this must take place inside the service user's room. Firstly, remove your gloves and be careful not to touch the outside of the gloves when doing this. 2. Clean your hands with alcohol gel. 3. Remove your goggles. 4. Remove your apron or gown, and do ensure that you avoid touching the front of the apron or gown. Steps 5 and 6 must be undertaken in the anteroom or directly outside the service user's room. 5. Remove the mask by bringing both ties together from behind your head over and pull away from your face to safely remove. Avoid touching the front of the mask. 6. Discard the mask into the bin and then decontaminate your hands with alcohol gel. The next set of video clips will demonstrate how to remove or doff your PPE. Open the bin with the foot pedal. Then remove the gloves. Sometimes removing your gloves can be quite awkward. They can often be hot and sticky, and this makes the process a lot harder. When you have removed your gloves, decontaminate your hands with hand gel. The next step is to remove your goggles. As they are reusable, ensure that they are placed in a suitable receptacle for decontamination. The next step is to remove your gown. Unfasten the ties at the back. Then, ensuring not to touch the outside of the gown, peel away from the neck and shoulder, unfold or roll into a bundle and discard. To remove the mask, grasp the ties from behind the head and pull the mask away and down from the face. PPE should be disposed of by double bagging. Waste should be left in a safe area for 72 hours, then disposed of as normal. If using clinical waste bags, follow the same procedure and then organise collection. Service users are not used to seeing staff in PPE, so this may cause and/or heighten their anxiety. Only use PPE as necessary, i.e. a service user may be able to maintain social distancing, so there is actually no need then to wear a mask. Constantly reassure and speak to the service user. Voice is a very important way in which service users will recognise you and be reassured. We will be providing more information about differing ways to minimise anxiety at a later date. A couple of useful tips for your safety and comfort. If you are in any doubt about the integrity of your PPE, check with a buddy and/or replace the item of PPE which is not intact or is fit for purpose. The PPE can be very warm to wear, so ensure you wear light clothing and ensure that your arms are bare from the elbow downwards, and no jewellery should be worn other than a plain commitment band. Comfortable washable footwear is also a good idea. You may want to consider bringing a change of clothes and have a shower before leaving work. Clothes should then be washed at the highest temperature that the clothes will tolerate.